A new program is providing critical care to trauma patients before they arrive at the hospital.
Over the last several months, first responders in Virginia Beach and Chesapeake have carried blood in the field. New at 6, Kaicey Baylor explains how paramedics are changing their response to save lives.
Now, come in. We would open the used lid that's being swapped for the day.
New equipment for first responders is defining the line between life or death.
And this will be the one that's due to be changed out. For years, all we used to do was just fill them up with a bag of normal saline, like IV fluid. And the used lid that's being swapped for the day.
Now, Chesapeake Emergency Medical Services Lieutenant Bobby Hogue carries a vital new tool whenever he's out on the job.
Placed into the cooler.
Nearly a year ago, the Tidewater EMS Council launched the Whole Blood Initiative, which allows first responders to carry blood in the field to administer to trauma patients over the age of 15.
When we started looking at our data, right, and how we managed our trauma patients, is that the impacts that we were having were rather limited because of the loss of blood is one of those things that really dictate outcomes.
It started in Virginia Beach and expanded to Chesapeake in April.
Until we had brought this on board, the only thing we could do is hopefully stop their bleeding and drive them to the hospital as fast as we can. Now we can actually start to reverse some of the effects of the patient being in shock.
It started in Virginia Beach and expanded to Chesapeake in April. Hogue is one of the first within his department trained to use it. He recently put that training to use to help a gunshot victim.
They were shot in the lower extremity, but they also met transfusion criteria through our protocol.
Hogue says by now using blood, paramedics like himself get to see the improvement in a patient's health.
Where their blood pressure can come back up. Now we have their mental status improving, and we can actually see tangible, observable improvements rather than just something we may see on a monitor.
David Long, the executive director of Tidewater EMS Council, says first responders have administered whole blood to nearly 30 patients between Virginia Beach and Chesapeake. He says most of these cases are connected to violence.
19 of them have been gunshot wounds, and we had one stabbing, and then we had one physical assault with a baseball bat.
He says so far about 19 patients have left the hospital.
We still have a couple of patients in the hospital. Most have been discharged successfully, so we're seeing about a 60.2% save rate of folks that we've been able to administer blood to.
Now, this program is not only a benefit to first responders, it's also helping doctors at Centera Virginia Beach General Hospital.
Getting that new blood, getting that immediate is very important for overall patient outcomes.
Ishraq Kabir, the trauma medical director for Centera Virginia Beach General Hospital, says a few patients have received whole blood before coming to the hospital. He says he's noticed a significant change that allows doctors to better prepare for any potential medical procedure.
But when they come to us, they're in a better state from a vital standpoint, and overall, if they come in a better situation, their outcomes after any sort of surgery or intervention that we would have to do, it is better for them.
Now Long is looking ahead and preparing for the next phase in this program, treating trauma patients as young as 5 with whole blood and expanding to other cities across southern Hampton Roads.
So we're looking for those opportunities to figure out how best to provide such a precious resource.
In Chesapeake, I'm Kaicey Baylor for 13 News Now.